Good afternoon, everyone. You are very welcome to the NCCP, your Cancer Prevention Questions Answered World Cancer Day 2025. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you're using an iPad, you will find this feature located at the top of your screen. Now, without further ado, I will hand you over to your host for today, Dr. Trina McCarthy, consultant in public health medicine. Thank you.
Hello, and you're very welcome to our World Cancer Day webinar, Your Cancer Prevention Questions Answered, which is hosted by the HSE on behalf of the Irish Cancer Prevention Network. The Irish Cancer Prevention Network is made up of Breakthrough Cancer Research, the HSE's National Cancer Control Programme, the HSE's National Screening Service, Irish Cancer Society, and the Marie Keating Foundation. And we'd like to begin today by playing you a short video highlighting the work of the Irish Cancer Prevention Network organisations. Thank you.
The Irish Cancer Prevention Network, or ICPN, was formed in 2018 to reduce the impact of cancer on the lives of people in Ireland. Its members support and collaborate on national initiatives around cancer risk reduction. ICPN is made up of Breakthrough Cancer Research, the HSE National Cancer Control Programme, the HSE National Screening Service, Irish Cancer Society, and Marie Keating Foundation. Breakthrough Cancer Research fund research, including prevention research, focus on low survival cancers, such as improving management of precancerous conditions like Barrett's esophagus, and provides expertise and patient resources on the impact of diet on cancer. The HSE National Cancer Control Programme works with health service providers and other partners to prevent and treat cancer and increase survival and quality of life by converting knowledge into strategies and actions. The HSE National Screening Service runs 3 population-based cancer screening programmes: Bowel Screen, Breast Check and Cervical Check. Their vision is to work together to save lives and improve people's health. The Irish Cancer Society work to ensure that more people learn how to reduce their risk of cancer and detect cancer early, advocates for improved health policies, provides information sessions and delivers national awareness campaigns. The Marie Keating Foundation has a range of awareness and education services focused on reducing cancer risk through lifestyle choices and highlighting signs of common cancers and how to spot cancer early. Cancer prevention is a national effort, and we are confident that together we can continue to raise awareness of cancer risk factors and ensure that people are provided with the information and support they need to adopt healthy lifestyles across Ireland.
I'm now delighted to introduce our first speaker for today, Edward Murphy, who's going to speak on tobacco and vaping. So Ed is a project manager with the HSE Tobacco Free Ireland programme. The programme works to implement the actions identified for the health service in the government's Tobacco Free Ireland strategy. And Ed has been with the programme since 2016, and before this he worked at Cork University Hospital in the implementation of the Sustainable Healthcare programme. We'll pass you over to Ed.
Hi everybody, and thanks very much to the ICPN team for asking me to come along and speak to you today about tobacco and e-cigarettes. What we'll do is we'll have a look at what tobacco smoking and e-cigarette use looks like in Ireland today. We'll look at the harms associated with both, and we'll look at how people can successfully quit smoking as well. So, smoking, not a big deal anymore. Nobody does that anymore, right? Well, the Healthy Ireland survey, most recently from 2024, which is a survey of adults aged 15 plus in Ireland, tells us that 17% of adults, that's people aged 15 plus, are still smoking in Ireland today. Now, the good news is that has come down from 23% in 2015. So we've made good progress over the last 10 years, but you can see there that from 2019 to 2024, we've kind of hit a wall, and there's a bit of stalemate at the moment. So we do need to work harder to get our prevalence rates down to 5%, which is our government target in order to be a tobacco-free Ireland. That 17% equates to roughly around 700,000 people in Ireland who are still smoking today. So that's 700,000 people who are at risk of developing avoidable preventable diseases and unfortunately dying earlier than they should. In terms of men and women, more men than women smoke in Ireland. So 20% of men aged 15 plus smoke, that's 1 in 5, compared to 15% of women, which is 1 in 7. The highest prevalence that we see is in the 25 to 34 year age category. So 20% of people in that age category are smokers. And we see that more people who are unemployed, 25%, smoke than people who are employed at 18%. And we do know that smoking is very concentrated in disadvantaged areas, that people living in these areas are more at risk of developing tobacco-related diseases. And a lot of the work of the HSE through the Sláinte Care Healthy Communities programme in recent years has been designed specifically to target people in those areas to try and bring that tobacco prevalence down. In terms of what smoking looks like in children, the Health, Behaviour and School-Aged Children Survey tells us that children aged 10 to 17, whoever smokes cigarettes has come down since 2018, so 12% and down to 9%. So these are children that have ever tried smoking a cigarette. And then we classify current tobacco smoking as being somebody who has smoked within the last 30 days. And that's declined from 6% in 2018 to 5% in 2022. So good news, but there is some concern that the proliferation of e-cigarettes is actually renormalizing tobacco use in our society, and we might look at that in a little more detail in a little while. So look, we don't need to dwell on this for too long. You'd be hard pressed and have to search long and hard to find someone in our society who doesn't know that smoking tobacco is incredibly bad for them. It raises your overall cancer risk almost everywhere in the body. It increases the risk of heart attack and heart disease. Causes irreversible lung damage, such as lung cancer and emphysema, whole host of diseases and problems associated with tobacco smoking, and incredibly damaging on the body. Tobacco use causes 4,500 deaths in Ireland every year. That's over 12 deaths every single day. And the sad thing about these is that they're all preventable and avoidable. 22% of all deaths from cancers are related to smoking. We see 44,000 smoking-related hospital admissions to Irish hospitals every year, and this translates to over 300,000 inpatient bed days that are used to treat tobacco-related disease across the health service in any given year. To put this into context, that would compare to the likes of St. James's Hospital in Dublin or Cork University Hospital, doing nothing but treating tobacco-related disease all day, every day, all year, every year. So there's a huge amount of capacity taken out of the Irish healthcare system due to tobacco-related disease. Treating this disease costs the health service directly €460 million every year. And interestingly, 55% of litter, the EPA tells us, is cigarette-related litter. It'd be interesting to see this updated to include e-cigarette related litter, because you'll all have seen news articles, etc., on disposable vapes being disposed of incorrectly in Ireland and actually littering due to e-cigarette use. So we might move into talk about e-cigarettes for a little bit, seeing as we've mentioned them. So what are e-cigarettes? Well, essentially, they're an electronic nicotine delivery system, and they're designed quite specifically to do one thing: to deliver nicotine to the human body. 99% of all the e-cigarettes you'll find on the market will be nicotine-containing devices. We've had them in Ireland as a consumer product now for about 20 years. They would have started off as quite rudimentary devices like the ones you'll see over here on the left-hand side of the screen that were designed to, almost look like conventional tobacco cigarettes. They were a bit clunky and they weren't very good at delivering nicotine, but they've gotten much better and effective at delivering nicotine over time. So you'll all have seen these tank style vapes, like the large one in the middle here. So these are rechargeable and refillable. And then in more recent times, disposable vapes have become very popular in the Irish market, and they're particularly popular among children and young people. The main reason being because they're cheap, they're easy to hide, and when you're finished with it, you just throw it away. So who is vaping in Ireland? So the Healthy Ireland survey tells us that 8% of adults aged 15 plus are using e-cigarettes. That's up from 3% in 2016. And we see the highest use then in people who are under 25 years of age. So that increased from 10% in 2022 to 18% in 2023. Among children and young people, the Health, Behaviour and School-Aged Children in Ireland study tells us that 9% of 12 to 17-year-olds identified as being current e-cigarette users in 2018, and that increased to 13% in 2022. And a different study then, a study called SBAD, which looked specifically at 15 and 16-year-olds, reported that e-cigarette use was up from 1 in 10 in 2015 to 1 in 5 in 2019. This study is currently being updated, and anecdotally, we would hear that that prevalence has increased again. So there's a worrying increase in the trend of e-cigarette use among children and young people. So what's in e-cigarettes? What's in the aerosol? And it is an aerosol. Even to call it vaping doesn't really accurately describe what somebody is actually doing, because it's not a vapor. An aerosol implies that there are small particles within the fog or smoke, if you want to call it that, that someone is actually inhaling. So the aerosol does contain volatile organic compounds. So these are chemicals that change when they're heated. You'll find heavy metals such as nickel, tin, and lead flavorings and chemicals that can be linked to lung disease, some carcinogens, ultrafine particles in the aerosol that the user is inhaling deep down into their lungs. And then, of course, nicotine, the ingredient that makes these devices so addictive. In fact, all of these chemicals that are scrolling onto the screen have been identified in e-cigarette aerosol. And the ones then that are highlighted in orange are recognized by the Food and Drug Administration in the US as being chemicals that are harmful to human health. And again, all of these have been identified within e-cigarette aerosol. So look, what is the evidence of harm due to e-cigarettes? So I suppose the Tobacco Free Ireland programme, we were developing clinical guidelines. These are a set of instructions and recommendations for clinicians and healthcare professionals to help people to quit smoking effectively back in 2020. And we needed to look at whether or not we were going to recommend e-cigarettes as a tool to help somebody to quit smoking. So in order to do that, we needed some evidence. So the Health Research Board conducted an evidence review for us, and they looked at three things. They looked firstly at whether e-cigarettes were effective to help people to quit smoking, and they found that e-cigarettes were no more effective than safe nicotine replacement therapy to help people to quit. They also looked at the harms from e-cigarettes, and they found obviously nicotine dependence. These are nicotine containing devices, so somebody who is using them is at very high risk of becoming addicted to the product, addicted to the nicotine. They found early evidence of damage to the heart and circulatory system, early evidence of harm to the lungs. You'll have seen on the previous slide the whole host of chemicals that can be found in the aerosols, some of them identified as being carcinogens, and then more unusual things like injuries and poisonings. So these would be things like blast injuries where a battery has exploded in somebody's hand or their face or burnt them through their pocket, and poisonings, so things like children who have ingested the actual e-liquid and become sick having done that. So definite harms from e-cigarettes. And then the Health Research Board also looked at whether or not there was a gateway effect for young people to transition from e-cigarettes to conventional tobacco smoking. And what the review found was that children and young people who used e-cigarettes were 3 to 5 times more likely to actually start smoking conventional tobacco than young people who didn't. So obviously we're concerned now about the proliferation of e-cigarettes in Irish society and the potential for this to renormalize tobacco use and ultimately undo a lot of the good work that we've done in bringing the number of children and young people who smoke tobacco down. It's worth looking at some old ads for tobacco products. So this is an ad from Murad cigarettes from 1919. You can make up your own mind about whether Santa Claus is meant to appeal to an adult or a child. But this is a newer e-cigarette ad from the last couple of years. So this is the tobacco style advertising taken forward into the future, and it's eerily similar. And also then in the social media age, we see companies like Juul who are using this type of advertising, particularly to target young people. And then you have these older type of cigarette ads as well that portrayed smoking as being sexy and attractive. Another one here. And then notice how the new e-cigarette advertising mimics the old tobacco advertising. And in fact, some of the e-cigarette manufacturers are actually owned by the tobacco industry. So the industry has become a bit interchangeable. and the old tobacco advertising playbook is very, very, very much in use here, and it's specifically designed to target children and young people and get them addicted to these products. The use of flavors in e-cigarettes is then also very attractive, and it's specifically designed to appeal to children. The devices are almost displayed or portrayed as being harmless. And then these newer disposable type devices, you'll notice the fruity, fresh feeling that resonates through the advertising, again, specifically designed to appeal to a young person. So what's been happening in the e-cigarette space legally? Well, the Tobacco and Nicotine Inhaling Products Act was passed at the end of 2023. So what this does is it introduces a licensing system to sell e-cigarette products. So as of 2026, vendors that want to sell e-cigarettes will have to register with the HSE, National Environmental Health Service. They'll also have to pay a registration fee. Importantly, it prohibits sales to children to under 18, so it is now illegal for an e-cigarette to be sold to somebody who's under 18 years of age. And it prohibits sales at children's events, and it prohibits advertising in certain places, such as on public transport and in cinemas. What it doesn't do yet is control the content of e-cigarettes, such as flavors. It doesn't control the packaging and naming of products, and it doesn't control point of sale display. So packaging and naming, you'll notice with tobacco products now, everything has to be in a plain packaging. Branding can't be visible on conventional tobacco products anymore, and they're not allowed to be displayed behind the counter in places where they're sold. This doesn't yet apply to e-cigarettes, but these are all other areas of legislation that the government are actively looking at. Just to bring us back, I suppose, to treating tobacco addiction, what the HSE does and how somebody who smokes might successfully go about quitting. Well, the HSE offers behavioural counselling and support to anybody who wants to come to one of our Stop Smoking services. So what that involves is somebody will attend either face-to-face or over the phone, 9 appointments or more over the course of 12 months, where they will work one-on-one with a Stop Smoking advisor to identify why they want to stop smoking, their triggers, coping mechanisms, and they'll be guided through their quit journey, essentially. And we also recommend that somebody uses stop smoking medication in the form of nicotine replacement therapy. And we recommend that somebody might use combination nicotine replacement therapy. So that would be a long-acting form of NRT, like a patch, and then combine that with something short-acting, like a spray or a gum. The idea being that you put your patch on and you get a nice, slow, steady release of nicotine throughout the day. The level of nicotine that's been given through the patch is much, much lower than somebody will have been getting when they were smoking cigarettes. So you may still get cravings, but you can kind of top up on the nicotine during the day then by using a gum or a spray to kill the cravings as they happen. And nicotine replacement products are now free to anybody who engages with the HSE Stop Smoking service. So you can get a 12-week supply of nicotine replacement therapy completely for free when you come to see us at one of our Stop Smoking services. So how do you access our Stop Smoking services? Well, I suppose a good first port of call is to go to www.quit.ie, where you can access phone support. You can also sign up for a free online quit plan where you can track your progress, or you can come to one of our face-to-face Stop Smoking clinics that are located all over the country. In fact, we have Stop Smoking clinics now in every county in the country. Our services were greatly expanded through this Launch Care Healthy Communities program a couple of years ago. We almost doubled the number of Stop Smoking advisors that we have working in Ireland. So we have complete national coverage with face-to-face clinics, and they're all available on www.quit.ie if somebody wanted to go and filter by county and find the nearest Stop Smoking clinic to you. We know that people who use HSE Stop Smoking services are twice as likely to quit smoking for good than if they try to go it on their own. And the good news is that if you stop smoking for 28 days, then you're actually 5 times more likely to be quit for good. So I think that's the take-home message, that there is help available. Our HSE services are very, very good. They're very, very effective, and we would encourage anybody who would like to quit smoking to come and see us. Our email address here is TFI, that's for Tobacco Free Ireland, at hse.ie, if anybody would like to get in touch, and I'll be around to answer any questions that people might have at the end of the webinar. Thank you.
Thanks for that presentation, Ed. And as you mentioned, he'll be joining us for the panel Q&A at the end, so I'm sure there'll be plenty of questions to be covered there. So we're going to move on now to a patient story. We'll share a video from Jacqueline Daly, who is talking about her own cancer experience with quitting smoking and vaping. And Jacqueline is the manager of East Galway and Midlands Cancer Support, and is also involved as a patient partner in a number of Irish and European initiatives. So we'll share her story now.
My name is Jacqueline Daly, and in 2005 I was diagnosed with malignant melanoma. My biggest fear was that I was going to die. Thankfully, with having a number of surgeries, my margins were clear and I was told I could move on with my life, and very, very grateful for that. I suppose when I was diagnosed, I started to look holistically at myself and see what could I do. I had a child to rear, I had a husband to look after, I wanted to live my best life. So I started looking at me and what I could do best for my health going forward. I was a smoker at the time, and I quickly realised that smoking was not going to do me any favours. I struggled for many, many years trying to give up cigarettes. We all know the statistics of the damage that cigarettes do, and in particular for cancer. I decided to get a network of support around me. I told my friends, I picked a date that I was going to give up cigarettes. I told my family, and I asked them to support me on that journey. I'm over 20 years off cigarettes, and I am so pleased that I have done that for me. I would encourage everybody to really consider giving up cigarettes if you're smoking. It's not easy, I know. One of the things that worries me greatly going forward is the epidemic of vaping. We see young children, 12, 13 years of age, vaping. It really worries me, the epidemic of cancer we're going to have going down the road if we continue to allow this to happen. It takes a village to rear a child. I would encourage everybody, if you see young people vaping, please talk to them and try and get them to kick it. Going through a cancer journey can be very, very difficult. It can be hugely isolating. It's a worry for the whole family. I would encourage anybody who gets a cancer diagnosis, regardless of what that diagnosis is, look for your local cancer support centre. There's invaluable help and support there, and you will get through that when you reach out and walk that journey with somebody else.
And sincere thanks to Jacqueline there for sharing your story and some very powerful words indeed. We're going to move on to our next presentation now, which is from Dr. Emily Orr on melanotan and sunbeds. And Emily is a dermatology registrar at Our Lady of Lourdes Hospital in Drogheda. She undertook her medical training in St. George's in London, where she also completed a BSc in global health. And during her internal medicine training, she worked with the melanoma team at the Royal Marsden Hospital. Since moving back to Ireland, she's become interested in the role that online platforms now play in influencing skin cancer risk behaviours. So I'll pass you over to Emily. Thanks.
Good afternoon, everyone. My name's Emily. I'm a doctor working in dermatology, and this afternoon I'm going to talk a little around melanotan, also known as the Barbie drug. So what we'll aim to cover is, what is melanotan, what are the risks and side effects, and how is it being portrayed on social media? And just for the purposes of this presentation, I just want to highlight that when we talk about melanotan, I'm referring to the unregulated drug sold on the black market. But before we go into that, I think it would be helpful to talk a little around skin cancer and why it's relevant for substances like melanotan. There are a few different types of skin cancer, but the deadliest form of skin cancer is called melanoma. Unfortunately, melanoma is something we see commonly in clinic, and across Ireland there are over 1,000 new melanomas diagnosed each year. Melanoma is caused when the pigment cells in the skin, which are called melanocytes, go into uncontrolled overproduction. This is a little diagram showing the development of melanoma in the deeper levels of the skin, where the pigment cells have started producing pigment in an unregulated way. The main risk factor for developing melanoma is UV exposure, whether this is via sun exposure or using tanning beds. overexposure to UV radiation causes DNA damage, which can cause your cells to mutate, leading to cancer. When we look at the literature, there is an association between melanotan use and melanoma, which is described in case reports. And by case reports, we mean there have been individual cases where people who have taken melanotan then go on to develop a melanoma. And this is why I'd like to spend some time talking about the dangers of unregulated melanotan use today. So melanotan is a compound that is sometimes used to promote tanning and weight loss. And for this reason, it's sometimes known as the Barbie drug. They are often taken as injections or nasal sprays, so people might talk about being on the tanning injection or the tanning spray. People that use these injections or sprays sometimes use them alongside tanning beds to maximize UV exposure. Melanotan works by stimulating those pigment cells in the skin to go into unregulated overproduction of pigment. Melanotan is illegal to sell. It's not a licensed medical product, and its production is completely unregulated. So what we do know, in recent years, there have been case reports of a possible relationship between melanotan use and melanoma. Now, larger studies looking at this relationship are lacking, but what we can say is because these tanning injections are unregulated, we do not know the full risks, and this is why we strongly urge people not to use them. Unregulated means that we do not know what the composition of the product contains, we do not know the purity, and we do not know if the product contains any other active ingredients. All this means is that users are potentially taking a risk without knowing the full story. As we've said, melanotan may be associated with developing melanoma. Melanoma is the deadliest form of skin cancer. And we know that 90% of melanomas are thought to be caused by excess UV light. We know that using a tanning bed before the age of 30 increases your risk of melanoma by 75%. And for this reason, tanning beds are put into the highest cancer risk category by the World Health Organization. Melanotan may also cause new moles to develop and may cause changes in the moles that you already have. And this can make it challenging to assess your moles in the dermatology clinic. As well as these concerns, melanotan may also cause a number of side effects, which include flushing, nausea, vomiting, reduced appetite, and can sometimes cause painful erections in men. As we've mentioned, because melanotan is unregulated, the vials that it's sold in may be contaminated with other compounds or with bacteria. You do not know what you're buying. For these reasons, the Irish Medicines Regulator, the HPRA, Irish Cancer Society, and Cancer Research UK have issued warnings against using melanotan. Melanotan is illegal to sell, but may be found being sold in tanning salons, gyms, and across social media. So onto the social media perceptions. We looked at 400 posts on social media which featured melanotan. We found that most people were using melanotan for tanning. And in these posts, only a quarter mentioned any potential side effects. Only a quarter mentioned skin cancer at all. And of those posts, over a third actually claimed that melanotan is protective against skin cancer. They made the claim that melanotan causes skin darkening, which means you're more protected from the sun. We know that there's no such thing as safe tanning, and tanning is actually a sign of too much UV exposure, increasing your risk of skin cancers like melanoma. So this is really quite a potentially dangerous and unproven claim. Only a very small proportion of the posts mentioned that melanotan is unregulated and illegal. We saw that many of the posts were offering to sell melanotan, either through a link to a website or by giving a phone number to make contact. And when we looked back at the 32 posts which claimed that melanotan is protective against skin cancer, we saw that 2/3 of these were actually offering sale of melanotan in the same post. We also saw that lots of the posts which were advertising melanotan were made to look like they were set in a clinical environment with the sellers wearing scrubs. And this might be to imply that melanotan is a safe medical product, which it's not, as it's not licensed and not regulated. So to summarize, melanotan is an illegally produced compound which is sold on the black market to promote tanning and weight loss. There is a potential association with the deadliest form of skin cancer, melanoma. It's illegal and unregulated, but despite this is promoted for sale on social media where there's lots of misinformation about its safety. I think this highlights the importance of promoting reputable sources of health information online and the importance of regulators to remove posts which are promoting dangerous, illegal products. I hope, having listened to this presentation, there's more awareness of these dangerous compounds and how sellers online may make false claims to make a sale. These are my references. Thank you so much for listening. Does anyone have any questions for me?
Thanks, Emily. And we'll keep questions to the end for the Q&A panel where Emily will join us, if that's okay. And you're very welcome to put those into the Q&A section there. We're going to move on to alcohol as our next topic to cover, and I'll introduce Dr. Cliona Ní Bhuicla, who's a public health medicine specialist registrar who's a keen interest in population level health and well-being. And her recent research includes awareness of alcohol as a risk factor for cancer, including possible approaches to reducing the alcohol attributable cancer burden in Ireland. Cliona is also a specialist in clinical microbiology, a fellow of the Royal College of Pathologists UK, and a fellow of the Faculty of Pathology, or CPI. Over to you, Cliona.
Thanks, Trina. Overall, 1 in 2 people living in Ireland would be diagnosed with invasive cancer in their lifetime. This equates to roughly 24,000 invasive cancers and sadly 9,000 cancer deaths in Ireland every year. However, almost half of all cancers are preventable, and the current National Cancer Strategy running from 2017 to 2026 highlights cancer prevention as the most cost-effective long-term approach for cancer control. Prevention can be achieved by reducing exposure to modifiable risk factors such as UV exposure, smoking, and alcohol consumption. Back in 1988, the WHO's IARC, which is the International Agency for Research on Cancer, classified alcohol as a Group 1 carcinogen. So this puts it in the highest risk group alongside asbestos, radiation, and tobacco. And in 2023, the WHO went one step further and came out with a statement that, in fact, there is no safe level of alcohol consumption and that any amount of alcohol consumption increases your cancer risk. Alcohol is causally linked to 7 different types of cancer, and we can see here in the infographic that the upper aerodigestive tract is disproportionately represented, with alcohol causing mouth, upper throat, larynx, and esophageal cancer. It also causes liver, breast, and colorectal cancers, and even though those proportions are lower, because we see higher numbers of breast and colorectal cancers, we see higher numbers of cases of breast and colorectal cancers directly caused by alcohol. In Ireland in 2020, it's estimated that there were approximately 1,000 cases of cancer that were directly attributable to alcohol. So certainly this is cause for concern. For those individuals who use both alcohol and tobacco, there is a further increase in risk, and they have a 5-fold increased risk of developing cancers of the mouth, throat, voice box, food pipe, compared to people who use alcohol or tobacco alone. For heavy users of alcohol and tobacco, the risk is up to 30 times higher. And this is due to a solvent effect, whereby alcohol damages the cells of the upper air digestive tract, and then also facilitates easier delivery of cigarette toxins to those cells, where they're then uptaken and can cause further damage. How exactly does alcohol cause cancer? So one of the big ways that it does this is by the generation of toxic metabolites or toxic byproducts, particularly acetaldehyde. So alcohol contains ethanol as its active ingredient, and in the body, this is converted to acetaldehyde. And acetaldehyde is carcinogenic. If this chemical is allowed to build up in the body, it causes chromosomal rearrangements and mistakes in DNA repair. And all of this damage increases your cancer risk. There is an enzyme, ALDH, which converts acetaldehyde to harmless acetate. However, particularly for individuals who are deficient in this enzyme, they also have a further increased risk of cancers associated with alcohol if they consume alcohol. Other ways in which alcohol increases your cancer risk include by increasing estrogen levels, which can be associated with breast cancer, by reducing folate levels, which can be associated with colorectal cancer, and by increasing weight, which is an independent risk factor for cancer. And in addition, the solvent effect, as we discussed in the previous slide, whereby alcohol facilitates easier delivery of cigarette toxins to the cells of the upper air digestive tract. How much are we drinking in Ireland? Well, data from Healthy Ireland 2024, issued just recently, told us that 73% of respondents in this nationally representative survey consumed alcohol in the last year, with 38% consuming alcohol at least once a week. So certainly alcohol consumption is high in Ireland. In terms of OECD alcohol consumption per capita for 2023, we were coming in at 9.9 litres, which is high in terms of comparable OECD countries. And it's important to remember that it's ethanol that drives the cancer risk. It's not the beverage type, so it doesn't matter if it's beer or spirits or wine. It's the ethanol drives the cancer risk, and it's any amount of ethanol. In terms of awareness of the alcohol cancer link, awareness is the first step on a complex pathway towards behaviour change of alcohol reduction or alcohol elimination. And when we look at the evidence internationally, we can see that there are low levels of awareness of less than 50% reported. Increasing awareness can drive behaviour change. There's a lot of emerging evidence coming from Australia now supporting this. And also we see in the international literature that increasing awareness of the alcohol cancer link, in fact, increases support for wider alcohol harm reduction policies. These are in alignment with the WHO's best buys and include things like reducing availability of alcohol, restricting advertising, and increasing price. All of this works together then to increase and result in a less alcoholic environment overall, so supporting the individual and supporting population level alcohol harm reduction. In Ireland, I conducted a study with the NCCP recently, looking specifically at awareness of alcohol as a risk factor for cancer in Ireland. And to do this, I looked at data from the very first national survey carried out by the NCCP, looking at cancer awareness and attitudes. So this was a nationally representative survey of 2,874 adults conducted in the Republic of Ireland between January and May 2022, conducted by phone. And what we found was a very stark finding that overall 43.7% of respondents had unprompted awareness of alcohol as a risk factor for cancer, which doesn't seem too bad until you consider that 81.6% of the same group in a nationally representative survey had unprompted awareness of smoking as a risk factor for cancer. So we can see certainly that there is a lot of work to be done. Looking a little bit more at this study, so I found that there were certain groups that were more likely to be aware of the alcohol cancer link, and this included females, those of middle and older age, those with cancer experience, higher medical literacy, higher alcohol consumption, and higher levels of physical activity. However, even within those who were aware, there was some confusion and misconceptions existed. For example, almost half of those who were aware of the alcohol cancer link incorrectly believed that alcohol only causes cancer if you drink a lot of it over a long period of time. So certainly the low level of awareness at population level, coupled with the clear misconceptions, show that there is a need for work to be done in this space. So the recommendations emanating from the findings of the study are first and foremost to increase awareness of the alcohol cancer link. And really important that it's a consistent message that's delivered that it's any amount of alcohol increases your cancer risk. So to do this, we're working at a population level, so sharing the findings of the study and spreading the message and raising awareness at important forums such as this event here this morning. We're also working with Alcohol Action Ireland. For example, we had a press release for the study findings back in December to coincide with European Alcohol Awareness Week. So doing a lot of important work in that space. And we're also looking at how to spread the message amongst higher risk groups, for example, younger males with lower levels of medical literacy. And we're also looking then at spreading the message in different settings. For example, in the healthcare setting, we're incorporating the study findings into the Making Every Contact Count programme, which looks at improving health behaviours and optimising management of chronic disease. And we're also looking at incorporating the findings into the NCCP's e-modules for healthcare professionals, so raising awareness amongst that population also. In addition, we're sharing these findings with the Department of Health to help support ongoing implementation of the Public Health Alcohol Act 2018. This is legislation that was introduced in Ireland to help reduce alcohol harm, and as part of that, there is a plan to add cancer warning labels to alcohol containers in 2026. So these study findings showing that there is a very low level of awareness of the alcohol cancer link in Ireland, coupled with the misconceptions, provides clear evidence that we need to continue the implementation of this Public Health Alcohol Act and that we need to continue to push for the addition of cancer warning labels on alcohol containers. In addition to the other measures that I mentioned earlier of reducing availability, restricting advertising and increasing price. Finally, the third recommendation of the study is to ensure that there is ongoing high quality research, for example, research with cancer survivors to ensure any messaging is appropriate and sensitively delivered, and also to ensure that we're continuing to monitor the trends on an ongoing basis to make sure that any measures we take to increase awareness, to put cancer warnings on alcohol containers, that the effect of those steps is measured, to make sure that it's the most appropriate use of precious resources. So in conclusion, this slide is taken from the very informative askaboutalcohol.ie, which is a HSE alcohol page, and it has some very useful tips and advice, including an alcohol assessment tool. And what it tells us essentially is that when alcohol is broken down in your body, it can damage your body's cells. As we've seen in this presentation, alcohol increases your risk and is causally linked to at least 7 different types of cancer. And you can reduce your risk of cancer if you do not drink alcohol. So essentially, the key take-home message here today is that the less you drink, the lower your risk of cancer. So with that, I'd like to thank you all for your time and welcome any questions from the floor.
Thanks for that, Cliona. And again, we'll just leave questions to the end for the panel Q&A, or if you want to enter any, we can answer them offline as well. We're going to move on to our final speaker now, who is Dr. Erin Stella-Sullivan. Erin is a lecturer in nutritional sciences at King's College London. She's a registered dietitian, and her research is in the areas of cancer, nutrition and body composition. Erin is heavily involved in professional advocacy and outreach, including as the lead for continuing professional development for the Irish Nutrition and Dietetic Institute's Cancer Nutrition Network, and as a member of the Nutrition Society's Parliamentary Advisory Group. So I'll hand over to Erin.
Good afternoon, everyone. I'm Erin Stella-Sullivan. I'm a registered dietitian and lecturer in nutritional sciences at King's College London. I'm going to give a talk today on eating well for cancer prevention. So the first question is, do food and nutrition impact on cancer risk? The answer is yes, simply, but I'm going to go into a bit more detail. There are many ways that food, nutrition and lifestyle can affect our risk of cancer, and one particular example that you might have heard of is that maintaining a healthy body weight can reduce your risk of all of the cancers shown on the diagram on the left or on the right. At least 1 in 3 cancers in Ireland actually are attributable to modifiable risk factors. So these are risk factors that you have potential to be able to change in your own life. However, there's no such thing as a superfood. And while watching the science news can be fascinating, you should trust public health guidance with your health. So how much cancer do food and nutrition and body weight and that sort of thing actually cause? In 2016, the National Cancer Registry of Ireland estimated that the proportion of all invasive cancers that were caused by different exposures were, for processed meat, less than 1% of all cancers. For alcohol, 2.4%, higher body weight, 5%, and smoking, 13%. So while these are relatively small numbers, and obviously smoking is the biggest one of these here, making multiple positive changes, even if they have small effects on their own, can help reduce your overall risk significantly. So to help us remember, we have this nice graphic from the World Cancer Research Fund, or the WCRF, and these are recommendations that they make based on the evidence as to what will help you reduce your cancer risk. We know that following these guidelines decreases your risk of getting cancer, and if you do get cancer, they also reduce your risk of it coming back. I know alcohol has been covered in detail by another expert, but just to make a little note on the fact that alcohol does contain calories. So a standard drink or unit has 10 grams of alcohol, and that has 70 calories of energy in it. Beers and wines also have carbohydrates, so they have even more calories in them. And obviously, this is important when it comes to managing your weight. A lot of people also have concerns around gaining weight if they quit smoking. However, it's really important to note that, as I showed you, the highest risk factor is smoking. So quitting smoking is always worth it. And if you are concerned about changes in your weight when quitting smoking, you can ask your GP to be referred to a dietitian, or you can look on the INDI website on the Find a Registered Dietitian page. Physical activity, again, not exactly a food, but it is very important in that kind of picture of managing your weight. Reducing sedentary behavior as much as possible is what we'd recommend, but obviously this is limited by the type of work that we do. So we can also do more in the rest of our free time. So the recommendations for adults per week are to get 150 minutes of moderate aerobic exercise, and this is cardio, you might have heard as well, or 75 minutes of intense cardio or aerobic exercise. And then in addition, to get muscle strengthening activities on at least 2 days. And this doesn't need to be going to the gym and lifting weights. It can be kind of body weight exercises, so maybe doing squats or things like that. Any exercises that engage your muscles. So the first of the specifically food and drink related guidance that I'm going to go through is sugar sweetened drinks. So we recommend to limit these. Sugar sweetened drinks being any soft drinks, excluding, of course, the diet zero or free versions of them, which have just artificial sweeteners, which are safe. Sports and energy drinks or electrolyte drinks, flavored juice drinks, sweetened tea and coffee, and flavored milks all count as sugar sweetened drinks. Mostly drink water then is our recommendation, or unsweetened drinks like milk. And for most adults, that would be low-fat milk we recommend. It's important to note as well that while smoothies and juices can be a source of fruit and veg, they only count for 1 of your 5 to 7 a day because they contain a lot of free sugar. We also recommend avoiding foods high in salt, fat, starches, and also sugar. And this includes fast foods and confectionery, and generally kind of what people know to be processed foods. So there's a lot of attention at the moment in the media around ultra-processed foods, but for cancer prevention, our concern isn't around the additives, preservatives, or processing methods, except for processed meat, which I'll come to. But our concern is because these foods are high in energy, which promotes weight gain. They're high in sugar, which promotes gaining fat around our abdominal organs, which is the most harmful place to gain fat. And also these foods can be very tasty, but not very filling, so that promotes overeating. Then when it comes to meat and processed meat, we recommend that a cancer prevention diet does not need to be meat-free, unless you obviously want to follow a vegetarian or vegan diet for some reason. That's perfectly okay. But red meat is a good source of protein, iron, zinc, and vitamin B12, so it has a place in the diet. We recommend limiting red meat to no more than 3 servings a week. So that would be about 350 to 500 grams of cooked weight. And red meat doesn't have to be like beef, obviously is obvious red meat, but it also includes things like pork and lamb that are a bit lighter in color. We on the other hand, recommend minimizing or avoiding, insofar as you can, processed meat. And that's ham, sausages, rashers, pudding, and any kind of charcuterie, so kind of like French sausages or treats or things like that. Then it comes to getting in lots of the whole grains, vegetables, salad, fruit, and legumes, so your peas, beans, lentils. These are high in fiber, they're lower in energy, and they have lots of healthy phytochemicals in them. So briefly, we recommend to eat more plants and to eat the rainbow, to get in lots of kind of color and variety. A simple way to try to work toward this in your own diet is to fill half of your plate with plant foods. I suppose give a little bit more if you have your plant kind of sources of starches, but half your plate with the colorful plant foods. And then each day aim for 5 to 7 servings of veg, salad, and fruit, and 3 to 5 servings of whole grains. And these are the serving sizes in the food pyramid. So if you're wondering what sizes those are, I will show you where you can find those in a bit. Another question that we often get is, can we reduce our cancer risk by taking supplements? And unfortunately, the answer is no. And in fact, some supplements taken at high doses can actually be harmful. However, there are supplements that we do recommend taking for other reasons. So folic acid is recommended to be taken by anyone who could become pregnant. And this is to prevent neural tube defects like spina bifida. And we recommend taking 400 micrograms per day. As with both of these supplements, if you've been recommended by your doctor to take a different dose or any other recommendation related to them, follow that guidance because that's going to be specific to you. Vitamin D3, then, we recommend taking 15 micrograms, or that might also be written as 600 international units, or IU, per day. For most people, we recommend doing this from October to March because the sun is too far away and it's not going to be possible to make that enough through our skin. So an easy way to remember that is Halloween to St. Patrick's Day. However, we recommend taking that dose all year long, every day, if you're over 65, if you have darker skin, because that makes it even more difficult for the sun to stimulate our skin to make vitamin D, or if you're pregnant. Breastfeeding is another recommendation to reduce cancer. Obviously, this doesn't apply to everyone, but if you have the opportunity and you're able to, breastfeeding does reduce your risk of breast cancer. It also helps the baby's immune system and reduces their risk of many diseases throughout their life. So the recommendation there from the World Health Organization is to breastfeed exclusively for 6 months and then complementarily, so alongside food, up to 2 years. But any breastfeeding is better than that. The good news is all of this advice is consistent with the food pyramid that you can find on the HSE website. So you don't need to learn a whole new recommendation set, and you can find the kind of serving sizes and examples of what a day of following the food pyramid might look like on here. Coming finally to body weight, which is, as I showed again early on in the slide, a significant risk factor for getting cancer. And the reason that is because higher body weight is associated with having higher levels of fat, and that has kind of an inflammatory effect, especially if you're carrying it around the abdomen, because that is surrounding your abdominal organs, and that's the most harmful place for it. So to reduce your cancer risk, you should aim to have a BMI as close to the end of the healthy range as possible, so the healthy range being 20 to 25, and to avoid weight gain during adulthood. And this would be either increasing BMI or actually even just your waist circumference. However, it has to be kind of acknowledged that a lot of people struggle to lose weight, and especially to maintain that weight loss over time. And rapid weight loss using restrictive diets is commonly followed by weight gain, often even more than was lost in the first place. So to get the best kind of bang for your buck in terms of preventing cancer, by following these healthy eating, alcohol, and physical activity guidelines, your best place to lose weight in a healthy manner. And even if you don't manage to lose as much weight as you would hope or any weight, these changes themselves will still improve your cancer risk. So this is just a kind of a visual to explain that, to make it make sense, hopefully. But there's all of these risk factors that are recommended and are known to help with reducing cancer risk. And body weight is just one of them. So if you can manage to make really healthy changes in all of the other areas, It's just a reassurance for yourself that you're still doing a really good job and that that is going to have a meaningful impact on your cancer risk. And importantly, it's about balancing risks. And because weight is just one risk factor, we don't want you to focus on weight loss alone at the expense of the other recommendations, which can be the case when people follow kind of restrictive diets and maybe cut out whole food groups and things to try to cut down on calories. But ultimately, then you might be not following the most healthy recommendations. If you had cancer diagnosis, healthy eating means a slightly different thing. Many cancers and their treatments can cause malnutrition, so you might be recommended to follow a diet that seems to go against some of these cancer prevention recommendations. And that's because high protein and high calorie diets are needed to protect your muscle and strength and to put you in the best position to benefit from cancer treatments. And then you might be asking, does this apply even if I'm overweight? And yes, for many cancers, the first sign of having the cancer is actually weight loss. So if you've been previously told to lose weight, but you have any sudden, unexpected or unintentional weight loss, you should still have that assessed by your GP. For people with cancer, we actually usually discourage weight loss during active treatment because we want to protect the muscle. As I mentioned, if you finish treatment and have no long-term nutritional issues as a result of your cancer treatments, you're kind of back to your usual, we recommend following these prevention guidelines again to reduce the risk of it coming back. And we know that people who follow the guidance after they have cancer do have lower rates of it coming back. These are some resources on the Breakthrough Cancer Research website that will help answer lots more questions, and they're available at the link there, but you can just Google Breakthrough Cancer Research and find them. In summary, having a healthy weight reduces your risk of cancer. So to do that and to just add to all of the good things you're doing to reduce your risk, you can eat more plants, eat less red meat, processed foods, and sugar-sweetened drinks, be more physically active, and avoid processed meat and alcohol as much as you can. These things are also good for preventing many other diseases. And to make it sustainable, start by making any change you can. Start small and slowly add changes as you get used to a new pattern. And it's never too late to make positive changes. Thank you.
Thank you for that, Erin, and we look forward to having you joining us on the panel at the end for the discussion. Just before we go to the panel discussion, we have one other patient story to share with you, and that's from Carl Corcoran. Carl had a lymphoma and is now very involved in exercise after cancer, and Carl works with XWell and is also an exercise coach.
My name is Carl, and in 2021 I was diagnosed with a high-grade B-cell lymphoma, and this was after a year of being misdiagnosed. This year I'll be 4 years in remission. The pain started in my knee and then developed up into my hips and into my shoulders and also my jaw as well. So over the course of about maybe 3 months or so, I went from being able to play football and do whatever to basically being bedridden. Over the course of about 8-9 months, the pain actually went away because I was told I'd had reactionary arthritis, and then about a month later the pain came back. My immediate reaction when the consultant told me I had cancer, I'd actually told him thank you because I hadn't got answers for over a year at this point. I was in hospital for about 4 or 5 weeks at a time, and then I'd have a couple of days at home and then be back in then for the second round. And in total did 4 rounds of treatment. I think exercise definitely has been one of, if not the most important part of my recovery, and even while I was in treatment as well. Just being able to see yourself getting stronger and getting fitter and not as many things affect you. I'd never have thought that in hospital I'd be able to get up at kind of 6-7 in the morning, go to the gym, do a workout, then come home, work, and then coach in the evenings. That would have just been completely off the cards for me about 2 years ago. I was told multiple times that I'd never be able to have kids because of the treatment and obviously the effects from that. But I've kind of firmly believed that because I did exercise and did take care of myself slowly but surely. We got the great news about 1.5 years ago that my girlfriend Leah was pregnant with Lucy. And now she's 16 months old this month, and she's completely thriving. And I never thought I'd be able to be a dad in the first place, but then also with the exercise and kind of looking after myself, it's allowed me to actually have energy for her and being able to play with her and obviously be a supportive partner as well.
Thanks so much to Carl Corcoran there for sharing his own story and the importance of physical activity. So I'm going to welcome back our speakers for a panel discussion now. Welcome back Emily, Ed and Erin. And Clíodhna hasn't been able to stay with us for the Q&A, but Dr. Breda Neville is a specialist in public health medicine and is going to join us. So you're all very welcome back. We might start with you, Ed, if that's okay. I've a question about if someone's a lifelong smoker, you know, is there ever a time that's too late to quit smoking?
No, I mean there are health benefits to giving up at any stage. Obviously, look, it's preferable that somebody quits as early in life as they possibly can to give themselves the best possible chance of not developing a tobacco-related disease. But we see people of all ages come into the service, and there are always benefits to quitting at any stage, even post-cancer diagnosis, you know. Because treatment can be more effective and all of those sorts of things if somebody stops smoking while they're actually undergoing cancer treatment. So we would say whatever stage you're at, always benefits from quitting. Yeah.
And I think it's worth mentioning again, you, in your presentation, you spoke about the free nicotine replacement therapy that people can get if they engage with the service. So that's a great link available.
12-week supply of combination nicotine replacement therapy. So somebody will get their long-acting patch and a choice of gum, mouth spray, whatever suits them best, completely free for 12 weeks when they come to see us at any of our services. Yeah.
That's great. And we just wanted to question about if whether or not smoking a pipe is safe if you don't inhale. What would be your
yeah,
advice?
look, I mean, common misconception, and we hear this about smoking pipes, smoking cigars, smoking roll your own tobacco, loose leaf tobacco, things like that. It's all equally as harmful. Yeah. So
quit them all. Yeah,
Indeed.
any type of tobacco. Thanks, Ed. Breda, we have a question on alcohol in terms of how many units of alcohol per week could you have that wouldn't affect your cancer risk? Could you give us some advice on that?
Yeah, I suppose, well, the key message really, I suppose, when it comes to alcohol and cancer risk is that there's no safe limit of alcohol consumption and that risk increases even with low levels of consumption. So we know that in Europe, half of all alcohol attributable cancers or cancers that are caused by alcohol are associated with what's considered to be light and moderate drinking. So in order to eliminate your cancer risk from alcohol entirely, you wouldn't drink at all. But I suppose having said that, the more you drink, the higher your risk. And conversely, the less you drink, the lower your risk. So if you do choose to drink, regardless of your current level of drinking, cutting down will reduce your risk.
That's great, thanks. And I might move to Emily now and skin cancer. I suppose you mentioned how skin cancer develops and that, but would you have advice for people just in terms of spotting a skin cancer? What would be the signs to watch out for?
Yep. So generally just for people to monitor their own skin, there's a really good mnemonic that we use, which is the ABCDE signs for checking your own moles. And if you Google that will come up and show you the different things to look for. Something that we sometimes recommend in clinic is for people to take a good picture of their moles if they have lots of moles, and then repeat that in 3 months' time, and then you know if anything's changing. But if there's anything that you're concerned about, anything new or changing, just to get checked out with your GP and get an onwards referral if they're concerned.
Okay, thanks for that. And to bring in Erin, if I can, it's a very comprehensive talk you gave there, Erin. But so sorry if we missed it. But did you mention artificial sweeteners at all? We have a question about whether artificial sweeteners would affect your cancer risk.
Thanks. So, and apologies for the hoarse voice. So basically, what we know is that we have very good evidence that sugar sweetened beverages with regular sugar are associated with an increased risk of getting cancer. And at the moment, we don't have strong evidence that artificial sweeteners have that same risk. So you might have seen kind of some stuff about things being classified as possible carcinogens, etc. But the amount that you would have to consume would be I think the number is 17 to 20 cans a day or something for it to have any risk. So really, as a stopgap, particularly if it's what allows you to reduce your intake of regular sugar sweetened beverages, the recommendation is to go with the artificially sweetened version.
Okay. And in terms of for somebody who's already had a cancer diagnosis, I know you touched on that towards the end, but in terms of a specific diet to really reduce your risk of cancer recurrence, could you just sum that up for us again?
Yeah, so again, the best evidence that we have, once you're kind of through treatment and provided that you don't have any, long-term kind of GI problems that might need the help of a dietitian to kind of deal with, we just recommend going back to these cancer prevention guidelines. And we have good evidence that people who follow these guidelines again after a diagnosis have a lower risk of it coming back. So yes, we recommend back to lots of fruit and veg, high fiber, minimizing sugar sweetened beverages, avoiding alcohol and processed meat if you can, and not taking any supplements. A lot of people think that there's lots of different supplements you can take, but advising against that. Yeah.
That's great. Yeah, no, all good advice. Yeah, could I bring Brita in next, just around, I suppose, our alcohol consumption in Ireland, and I suppose, what efforts are being made to reduce our overall alcohol consumption?
Yeah, so actually from a public policy perspective, we're doing quite a lot in Ireland. So the Public Health Alcohol Act was brought into law in 2018, and that includes a range of evidence-based measures that are designed to reduce alcohol consumption. So some of them have already been introduced, and the remainder are in the process. So of the things that have been introduced, they include separation of alcohol products in retail outlets and restriction on promotional offers. So things where you might be giving away reduced priced alcohol or free alcohol with other products. The other thing that has already come in is the restrictions in terms of advertising. So it's now illegal to advertise on sports fields and in certain areas like within 200 meters of schools. And there's also a broadshed there's a broadcast watershed for alcohol advertising, which just came in before Christmas. So now you can't have any alcohol ads on the television before 9 o'clock in the evening. And minimum unit pricing is also in place. So that means that there's a floor price for alcohol. So you can't sell alcohol at anything cheaper than 10 cents per gram. And then the kind of the remaining thing from the act that's due to come in May 2026 is the labelling. So the labelling is going to include information on the risks of drinking in pregnancy, liver disease and cancer, and it'll also include information on the alcohol content and the calorie content of the alcohol product. And there'll be a link as well to the HSE's askaboutalcohol.ie website. So I suppose in terms of the international picture, some other countries do have warnings. For example, in France, they have a warning about pregnancy. But in terms of the scope of this label and how comprehensive it is, it's a world first, really. So, it's a really positive development in terms of what we're doing to reduce our overall consumption.
So we're going in the right direction anyway, hopefully. That's great. And I suppose there's a lot of legislation there to go back to an unregulated product in melanotan. Can I go back to you, Emily? Just I suppose if you were speaking to somebody who was tempted to use melanotan and you were trying to sum up the side effects or the health effects, what would you say to them just in terms of avoiding the product?
Well, I suppose the main thing to highlight is that we just don't know what they're taking. That's the worrying thing about melanotan. And it's sort of completely unregulated and being produced by who knows where and by people that you don't know what their qualifications are. And the evidence out there is that there is potentially this link with melanoma. So I would just strongly advise people not to use it. There's really good sunless tanners that you can use. They look just as nice and they don't have the same risk. That's what we would advise people.
To just avoid the Barbie drug.
Absolutely, yeah.
No, absolutely. And maybe just for a last question, we might go back to you, Ed. Again, I suppose thinking maybe of a similar demographic and young people, and there were some fairly stark statistics you shared in terms of the number of people, was it 15, 16-year-olds, 1 in 10 vaping, going up to 1 in 5. So as a mother of children in that age group, how can you summarize, I suppose, the effects of vaping on young people, and should we be concerned?
I suppose the first thing is nicotine addiction. So these are products that are delivering nicotine to people now as effectively as a traditional tobacco cigarette does. And one of the disposable vapes that are particularly popular with children and young people, like that's the equivalent of about a 20-pack of cigarettes. So you're going to get nicotine addiction developing in children and young people very, very quickly. Which means that they're going to go back and have to continue to buy the product. Obviously, there are short-term harms from nicotine in terms of impulse control, mood, difficulty studying, concentrating, and then withdrawals when somebody actually can't access the product. So people will become irritable, they can get nauseous, they can start to feel sick, cranky, tired, all of the undesirable effects that come with nicotine addiction. And then I see lots of stuff in the chat about cancer risk from e-cigarettes and things like that as well. So look, I mean, we're not completely sure what that picture may or may not look like yet. I'd love to sit here in 10 or 15 years' time and say that we're not seeing a cancer disease profile associated with e-cigarettes, but unfortunately the emerging research is suggesting that the products contain definite and probable carcinogens and that they will likely cause similar cancer-associated gene deregulations that combustible tobacco does. Obviously, we hope that they won't, but it's probably more likely that they will than not. The industry makes this argument that they are safer than combustible tobacco, and we kind of stand back. And while we agree with that to a certain extent, okay, sure, you don't have all of the tar and some of the other chemicals associated with smoking combustible tobacco, but safer than. But everything is safer than combustible tobacco. Like we're talking about something that kills 50% of its long-term user base reliably. So it's a very low bar for safety to say that something is safer than that. I kind of make this comparison that if smoking combustible tobacco is like being hit by a car at 100 kilometers an hour, is using e-cigarettes being like being hit by a car at 60 kilometers an hour? Is it 40, or is it just easier to not get hit by the car in the first place? And unfortunately, then we're seeing the potential gateway back to conventional tobacco for young people as well, and undoing all of the good work that we've done. I could talk for a long time about the potential problems that are there with e-cigarette use. It's unfortunate that we don't have dedicated services to help young people to quit vaping in Ireland yet. I've just seen that they've stood up the First Stop vaping service in the UK, an NHS-funded service in Liverpool. So we'll see how that goes. And we have started talks with the department about potentially what that might look like. We have a body of research open this year with the RCSI to start to look around at what vaping interventions might look like. First principles thinking would bring us to a place where we think it probably would look like tobacco cessation, that you'd get behavioral support and counselling, maybe nicotine replacement therapy, but flavour profiles are different and things like that as well. And there might be dual use. People can be using cigarettes and e-cigarettes together. So that's a whole kind of a muddy picture at the moment that we're trying to work out. But if people are concerned about vaping or they have children who are vaping, you can call the Quit line. Visit quit.ie or call 1-800-201-203 and they will advise you on the best course of action.
Okay, that's helpful to know as well. Look, I'd just like to thank, we'll bring the Q&A session to a close. We'll thank everybody for joining us today, all of the listeners. I'd like to thank all of the speakers and panelists. So thanks to Ed, Erin, Cliona, Breda and Emily. A particular thanks to Jacqueline and to Carl for sharing their personal stories with us today as well. If you're interested in receiving regular information on the evidence and initiatives to reduce your cancer risk, I'd like to encourage you to sign up for the Irish Cancer Prevention Network e-zine. So that's at irishcancerpreventionnetwork.com, or it'll be in the chat there for you. And then also, as you leave the session today, we'd really appreciate it if you could complete the post-webinar survey, just so we can continue to improve these sessions. So thank you again to everyone for joining us, and we'll bring it to a close. Thanks.